Then I'd like to go ahead and introduce my colleague, Dr. Randy Ramcharitar, who will be presenting on the sort of the top 10 shows. I worked with him for almost 7, 8 years before I moved to Charlotte. Just an incredible physician, and now is the section head of vascular medicine at University of Virginia and the fellowship program director.
Hello, everyone. I just want to start off by saying thank you to Dr. Kim and Dr. Sharma for allowing me to be part of this awesome symposium where you're extending out FMD outreach and expanding the education on FMD. I want to thank the patients who shared their stories also. And I think we've learned a lot of information today. I'll run us through some of what I think are the top 10 items from the consensus statement. And all of this should be a review of things you heard from other speakers today, and so expect all of you to get 100% on the questions. All right, so according to the FDA, what's the maximum amount of people, okay, that could be diagnosed with a condition in order for it to be considered rare? Is it less than 10,000, less than 100,000, less than 200,000, or less than 500,000 people? So what do we mean by a rare disease? Okay. Looks like we're still getting people voting here. Okay, looks like it slowed down, maybe a little bit more. All right, let's move on here. All right, so to be considered rare, it's less than 200,000 people that are affected. And so FMD is rare. We just heard from Dr. Sharma, there's close to 5,000 patients now in the US registry. Our true prevalence is unknown. That's because, FMD can be clinically silent, found incidentally. And as we heard before also, our estimates are based on transplant donors, renal interventions, cerebral angiography, autopsy series. Okay, let's see, gotta click that one too. All right. So what is the prevalence of renal FMD in kidney donors? Is it 1%, 3%, 5%, or 7% of those kidney donors who, when they get diagnostic imaging, are found to have renal FMD? Yep, hopefully everybody remembers this from before. All right. Looks like we're good about there. All right, so it is about 3% of renal donors are found to have FMD. And so here we can see a list of those studies that help us come up with that number, about 3.34% of renal donors with FMD. And then on autopsy studies, about 1% of patients found to have renal FMD. With respect to carotid FMD, we see a higher prevalence in those patients who've had carotid or vertebral artery dissections. On patients who had cerebral angiograms for any reason, a bit lower, about up to 3%. And then an autopsy study found only about 4 patients out of 20,000 with cervical or intracranial FMD. So it does sound pretty rare, but maybe not as rare as we think. So a recent database review about 40 million hospitalized patients in the US showed that about 12 out of 100,000 had FMD. So if we do it based on our current US Census data, that's potentially about 41,000 patients in the US. And then others estimate anywhere from 1 to up to 4% of women have FMD. And so again, if we're just using our current US Census data, maybe that's up to 6 million in the US with FMD. So definitely we're not doing a good job of finding it and looking for it. And as we've heard today, we know FMD commonly affects the medium and small size arteries. The renals and the carotids are most commonly affected, but it can affect any arterial bed. So based on our registry data, what's the percent of patients who've got FMD in their lower extremity, upper extremity, and mesenteric arteries? So you got to get all 3 of these right in order to get the question right. This is a tougher one. we slow down there. All right, so it's actually 45% with lower extremity FMD, which we see here a picture of that in the external iliac arteries. About 23% have upper extremity, and then 15% have mesenteric, and that's a picture there of the superior mesenteric artery. And then what's important to note is that FMD can actually affect multiple arteries in the same person. So what percent of patients have multivessel FMD? Again, hopefully you guys remember this from just a few minutes ago. All right, looks like everybody's on the right track here. Yep. So you're correct, 55%. And so when we look at the breakdowns, about almost a third have it in 2 different arterial beds. And then as we increasing the sites, obviously the amount of patients go down. But yeah, about 55% with multivessel FMD. Now, similar to the transformers, there's more that meets the eye than with FMD, and there's more than just beating. So what percent of patients have aneurysms and dissections? Again, so you've got to get both the aneurysm right and the dissection. Right, let's go. All right, so about 23% of with aneurysm and 28% with found to have dissections. And just like Dr. Sharma had shown, dissections about extracranial carotids about 63%, vertebrals about 20%, and then in terms of aneurysms, about approximately the same in the renals and extracranial carotids. Another important point to make is that our FMD patients can have significant tortuosity. We saw this on some of the slides earlier. And in fact, that S curve, that winding tortuosity is an important marker for patients with FMD. And about 32% of patients with FMD have been found to have that specific type of tortuosity. Okay, so which of these is incorrect? More money, more problems, or more beating, more problems? All right, so you can see from this scientific chart right here, more money, more problems. But that's not the case for FMD. We can't say that just based on the appearance that there's going to be a higher risk of stenosis or a higher risk of dissections or cardiovascular events. And taking a look at this picture, this gives us a pretty good idea of that. So this is the renal arteries of different patients, and you can see different amounts of beating. And some of you may think, picture A may have the most beating, and so definitely would have the largest pressure gradient, but you can see that we actually have to measure the pressure across the lesion. You can't base it just on how it looks. And even picture D here looks like it has a significant amount of beating, but no significant gradient. All right. So number 7 for top 10 things is just, again, like we said, these symptoms can be quite variable, and it really depends on the location, severity, and type of FMD that a patient has. And patients often report at least 3 symptoms associated with FMDs, but these can be non-specific, and up to 6%, close to 6% of patients actually don't have any symptoms. And so we saw this earlier also, just to refresh, when to suspect carotid FMD. If patients are having these chronic migraines, pulsatile tinnitus, you hear a bruit, suspect FMD, or if it's a young person with, hypertension at a young age, uncontrolled hypertension with multiple medications, or you're suspecting a renal artery aneurysm or dissection, consider renal FMD. Okay, so there's still, on Twitter looking here, there is this recent post. Dr. Ninja Cat had a person with carotid FMD and wanted to know what kind of imaging to get me out. So Dr. Gornick here actually replied and gave some really helpful, good information. And so we know there's multivessel FMD. We know there's high rates of aneurysm and dissection. And so we want to get that CTA from brain to pelvis at least once to make sure that we're looking for other sites of FMD or aneurysm or dissection. And so what about ultrasound? We heard some information on this before also. There was a study from Cleveland Clinic that showed that, you know, if you were in a center that had good expertise, you could detect ultrasound with ultrasound carotid and renal FMD, but you could still miss it about 40% of the time. And so what the consensus statement says is, in a high volume center with expertise in FMD, you could use it to find FMD, but you'd still be missing out on places like the distal carotid, the vertebral, and the intracranial arteries. So in the end, you still want to get those to look at CTA to look at those other areas. All right, we're getting close to the end here. So number 8. So we've heard a lot of things about aneurysms, dissections, and just to reassure you guys, most patients can be managed conservatively. Medical therapy and surveillance. We've heard about aspirin, antiplatelet therapy, antihypertensive therapy, migraine medications, and then, you know, maybe routine surveillance with ultrasounds is needed. And for those patients who did need a procedure, only about a third of them needed either angioplasty for their hypertension, coiling for an aneurysm, or stenting of a dissection. And things can be a little bit different for men, though. It can be, even though it's even more infrequent in men, it can be more aggressive. We see men suffering from abdominal pain more frequently, renal issues, also having renal, intracranial, carotid, mesenteric involvement, and a higher rate of arterial dissection and aneurysm. So this is a recent paper from 2021 that's actually showing us that men here on the left side of the chart have a higher rate of aortic dissections, renal artery dissections, and then also a higher rate of aneurysms in their vertebral, coronary, and thoracoabdominal aorta. Okay, so which of the following is incorrect? Anything that glitters is gold, any artery that has beating has FMD, or all of the above? Yeah, I think you guys got it here. So it is all of the above, okay? So here we see these beaded pictures of arteries on angiogram here, really symmetric beading going down the whole artery here. You can see it on both sets of images. And then here is actually a patient with FMD. Looks very irregular. The beading is not symmetric. It's not uniform like we saw on those pictures just now. And so those other pictures actually represent standing waves. So not all beading is FMD. And in fact, what we were seeing there is the standing waves, which could be induced by certain medications or having a catheter in the arteries causing that vasospasm. But sometimes these findings may just be a result of imaging artifacts or other diseases that can present similarly. So other heritable connective tissue diseases we heard today can have similar presentations. Loeys-Dietz syndrome, Ehlers-Danlos, also associated with luminal irregularities, aneurysms, and dissections. So those are the top 10 things. And just to leave you with this summary of slides, non-atherosclerotic, non-inflammatory disease of the medium and small vessels, much more frequently in women, but can be more aggressive in men. Patients have a clinical spectrum of presentation. We should be getting brain to pelvis imaging on everyone. You can see beaded or the focal type. And remember, the amount of beading does not determine your severity. And in most cases, patients can just be medically managed. Thank you very much.